Good day, everyone. I am Chris Yusadel Kalinawan, a student at Wesleyan University, Philippines. And today, I'll be discussing medication administration in clinical practice. In this session, I will be focusing on the best practices to ensure safe and accurate medication administration. This is an important skill in nursing as it directly affects patient safety and quality of care. By the end of this session, you should be able to understand the importance of medication administration in patient care, identify the five rights, depict the steps in preparing and giving medication, properly document the procedure, and avoid common errors that affect patient outcomes. Proper medication administration is essential for patient safety and effective care. It's a fundamental part of nursing practice that helps ensure the right therapeutic effect while preventing errors in patient harm. Let's dive into the critical steps and the five rights of medication administration. To ensure medication is given safely, we follow the five rights. These five rights act as a checklist to confirm that we are giving the correct medication in the right dose, at the right time, through the right route, and to the right patient. Here are the step-by-step process for medication administration. So first, let's check the medication order. Always verify the order and the patient's information. This is the part you will use the five rights. Second, verify the patient's identity. Confirm the patient using two identifiers, such as full name and the date of birth. Third, prepare the medication. So you have to double check the medication, the dose, and the expiration date. Again, use the five rights. Fourth, administer the medication. Ensure the correct technique for the route of administration. And lastly, document the administration. Accurately document the time, the dosage, and the route of medication given. Now, I will show you a video demonstration on how to administer oral medication by following the five rights. Pay close attention to how the nurse verified the patient's identity, checking the patient's medical history, and ensure the right medication and dosage. Afterward, I encourage you to practice this technique using the same materials.
All right, this is medication administration. I'm going to start by entering the medication room and performing hand hygiene. Then I am going to open the electronic medical record. I'm going to access my assigned patient's MAR or EMAR. My patient is Skylar Hansen with a date of birth of 3/11/19XX. And I look at the chart and see if she has any allergies and she is allergic to iodine. I am going to give the 8 and 9 a.m. medications. When I look at the MAR, I can see that she is due to get a Tenolol 25 milligrams at 8 o'clock. So I'm going to pull that out of the drawer. And then I also see that she is due for hydrochlorothiazide at 9 o'clock. And so I'm going to take that out of the drawer as well. And I'm going to begin by doing first an assessment of the medications and are they appropriate for this patient. So atenolol I know is a beta blocker, and I know it is given for hypertension. It's also given to people who've had a heart attack, or it can also sometimes be given for heart failure. So I look and I see that Skylar has pneumonia, angina pectoris, and hypertension. So the beta blocker atenolol would be appropriate for this patient. I also need to do an assessment before I give this medicine. I need to check the blood pressure and the heart rate. I did that before I started my medication administration. The blood pressure was 128/82 and the heart rate was 76, so it is safe to give this medicine. Now I look and see the next medicine is hydrochlorothiazide. That's a diuretic or a water pill. It's given for heart failure or for hypertension. And so I see that Skylar has hypertension, so this is an appropriate medicine for Skylar. I need to do an assessment for this medicine as well. I need to check the blood pressure, which we said was 128/82. or 72, I believe. And then also we need to check the potassium, the serum potassium. I looked in the chart and I saw that the serum potassium was 4.0. And so the blood pressure and the potassium are within normal limits. It's safe to give this medicine. Then I'm going to begin my first check of the medicines. I start always with the patient name, Skylar Hansen, the name of the drug, atenolol, the dosage 25 milligrams, the route is oral, it's given daily at 8 a.m., and I'm looking at my package and at the MAR at the same time, and I also look at the package expiration date and make sure that the package is intact as well. And I see the expiration date is not till 2020. Then I start with my next medicine, and again, I have to start with the patient name each time. Skylar Hansen, hydrochlorothiazide. It comes in 25 milligram tablets. The dose that's ordered is 50 milligrams. I have to give 2 25 milligram tablets. So I see the name of the medication on here, and I see the dose is 25 on each tablet, which is appropriate. It's given oral, which this is a pill, daily at 9 a.m. I check the expiration date, which is not until 2020, and I see the package is intact. So now I have completed my first check. Now I'm going to leave the med room, and I'm going to go outside the patient's room with my rolling cart here with the computer. Once I am outside the patient's room, I'm going to start my second check. I already did all my checks of the assessments and the appropriateness of the medication, so I just need to check the rights of medication administration. I always start with the patient name, Skylar Hansen, atenolol on the MAR and on the drug package, 25 milligrams, oral, today at 8 a.m. Then I move on to my next medicine. I start with the patient's name again, Skylar Hansen, hydrochlorothiazide, 50 milligrams, oral, today at 9 a.m. And I check on the chart, as I checked earlier, the date of birth, and I checked the allergies on the chart. It says the patient's allergic to iodine. I know that these medicines do not contain iodine. So now I'm going to enter the patient's room. Come in. Skylar says, come in. Hi, Skylar.
Hello.
How are you today?
Well, I'm doing okay.
All right. I am doing hand hygiene as I enter your room. Skylar, I'm here to give you your medications. I have your 8 a.m. and your 9 a.m. medicines because it's about 8:30 right now. Is that okay?
Yes, it is.
All right. So first I'm going to start by asking you to tell me your name and your date of birth.
My name is Skylar Hansen, and my date of birth is 3/11/19XX.
All right. That's what it says here on your armband, and I'm scanning it. B. And I'm also looking at the MAR here, and I see it's a Skylar Hansen, 3/11/19XX. So it matches. And I'm also asking, Skylar, are you allergic to anything?
Yes, I'm allergic to iodine.
Okay, and that's what your chart says as well, so that matches. And I'm not going to give you anything containing iodine today. Okay, so now I'm going to continue checking your medicines before I give them to you. So I start my check again with the patient name, Skylar Hansen, atenolol, 25 milligrams oral at 8 a.m. And I must scan the package. Beep. And now I check my next medicine. Remember, starting with the patient name, I have Skylar Hansen, hydrochlorothiazide, and they're 25 milligram tablets, so I'm going to give 2 of them to equal 50 milligrams oral at 9 a.m. And now with this, I have to scan each pill. Beep, and then it beeps again. So you see I have to scan each one. All right. And so I'm ready then to give those. My last step, though, is Skylar, I have your atenolol and your hydrochlorothiazide. Are you familiar with those medicines?
Oh, I think I take those both at home. Is that my water pill?
It is your water pill, and then your atenolol is that beta blocker. It's for your hypertension and your angina.
Oh, yes, yes, I know those.
Okay, and the hydrochlorothiazide, that's a water pill. It's going to make you go to the bathroom a lot.
Right, right.
Okay, I'm going to put your head up so that you swallow your pills. Say when.
That's good.
All right, so there's 3 pills in total. Do you want to take them one at a time or together?
All together.
All right, so here are the pills, and here's some water.
Thank you.
And did you swallow that okay?
Yes, I did.
Okay, and then I'm going to complete medication administration by completing my documentation. The documentation started when I scanned the medicines, and now it's completed when I complete it here on the computer. All right, Skylar, I'm going to come back and check on you within the hour. Is there anything that you need right now?
I don't think so.
All right, your call light is right here. If you need me, please call. Would you like your head back down?
Sure, just a little bit.
All right, say when.
Right there.
All right, so we're all done now. That completes medication administration.
Just a quick recap of the video. The nurse demonstrates proper medication administration by following essential safety protocols. She begins by thoroughly disinfecting her hands to maintain hygiene and prevent infection. She then double checks the medication, ensuring that she adheres to the five rights of medication administration: right medication, right patient, right dose, right route, and right time. These steps ensures that the medication is accurate and appropriate for the patient. Next, the nurse reviews the patient's medical records to assess any potential allergies and gain insight into the purpose of the medication and the expected outcomes. This is crucial for patient safety and informed decision making. To ensure the right patient receives the medication, the nurse verifies the patient's identity by asking for two identifiers, such as their full name and the date of birth. She also inquires that any allergies that the patient may have to prevent adverse reactions. Before administering the medication, the nurse provides the patient with clear information about the medication, explaining what it is for and what the patient can expect. This helps promote patient understanding and cooperation. Once the medication is administered, the nurse ensures the patient's comfort and privacy, reinforcing a supportive environment. And lastly, she accurately documents the procedure, including the medication given, dosage, route, and any relevant observations. It is also essential for nurses to monitor the patient after administering the medication, observing for any potential side effects or changes in the patient's health status. This ongoing assessment helps ensure patient safety and timely interventions if needed. Once again, as stated previously, after the medication has been administered, it's crucial to document it accurately. The documentation should include the medication name, dose, route, time, and any immediate patient response. Accurate records are essential for continuity of care and legal purposes. Common errors in medication administration can have serious consequences. These include administering the wrong medication, incorrect dosages, or failing to verify the patient's identity. So always follow the five rights to minimize these risks. To summarize, medication administration is vital for patients' safety and care. By following the five rights, being vigilant about errors, and documenting accurately, we can provide the best care possible to our patients. Now that you've seen the steps involved, I encourage you to practice these techniques with the materials available to you. Remember, the more you practice, the more proficient and confident you will become in safely administering medications. Keep these tips in mind. Always double check your work, stay vigilant, and never hesitate to ask questions if you are unsure. That is the end of my presentation. I hope that you learned from this video and will apply them in your nursing practice. Always remember that practice makes perfect.